Joining us now for how things are actually playing out is Dr. Parikh, immunologist and vaccine researcher at NYU Langone. Doctor, thank you for coming on. We need your insight now more than ever. A lot to do. What do you make of those UK comments? Is this not the same disease?
Yeah, those comments are accurate. You know, it really depends on one basic thing. Are you vaccinated or are you unvaccinated? So for those who are unvaccinated, it actually is very similar to the same disease. We are still seeing these individuals in the hospital, in the ICU, sadly passing away. But for those who are vaccinated, it's much more reassuring and promising. You know, it's a much milder form. Less people are getting admitted, especially if you've had both shots and your booster. However, it's not the same for children. And again, it's because majority of the children are unvaccinated to date. So with them, we are actually seeing quite a spike in hospitalizations and even ICU admissions.
Okay, can you take us into that a little bit more? Because it is a sensitive subject. I'm a parent. You're probably a parent. It's scary. We don't want our kids to get anything. There was a stat, 395% jump in hospitalizations, and that's a scary stat. Then you dug into the numbers. It was 22 to 109. So overall, a still very, very small number of children, thank God. What exactly are you seeing, at least at NYU Langone, about numbers and seriousness?
Right. No, those are all very good questions. So absolutely, there is an increase, especially in areas like in New York City. We're seeing a five-fold increase, up 35% from last week. But remember, to be a child who's admitted to the hospital, you have to be pretty sick. Children are very resilient. So these are children who are requiring oxygen. They are dehydrated. So they are the more severe cases. And again, largely unvaccinated. So it may be those children who are not yet eligible for a vaccine, those who have not yet gotten their vaccine. So yes, it's not all gloom and doom, but we cannot ignore it either. Nationally, we're seeing the same thing. Hospitalizations are up 50% in the pediatric population compared to this time last year. Yeah. So again, we don't want to ignore it either.
I posted something last night on Twitter because it's also, I don't want to create anything about a twindemic, but the flu seems to be rocking. I mean, we're 600% higher than 2018 at the same time. RSV is up as well. What else are you seeing with the kids, doctor? And what's your advice to parents right now?
Yes, absolutely. And, you know, flu and RSV historically are more dangerous in children than even the SARS-CoV-2 virus or COVID-19. You know, last year we had a little break and reprieve from the flu, likely because everyone was still home, masking. Yeah. But this year we've already had pediatric deaths. We've already had 2 deaths. Last year we only had only one in the whole season compared to 200 the year before the pandemic began, right? Before everyone was locking down and doing all the social distancing measures. So I would recommend to parents, if your child is eligible for a flu shot, please get it, because flu can be very dangerous in children, even deadly. We've seen that every year.